Hello everyone, I am Dr. Mohammed Hashim, Consultant Physician, Care Hospitals, Malakpet, Hyderabad. Today I am going to tell you regarding the prevalence of diabetes, means the burden of diabetes in India and world, and also the risk factors of diabetes, that is the things which increases your chances of getting diabetes. So let's begin. Diabetes is a silent pandemic which is going on throughout the world and the cases are increasing gradually. If you look at statistics, throughout the world, 43 crore people are affected with diabetes, and in India, if you look at data, around 8 crore people have diabetes. So if you look at Indian data, if you look the persons above age 50 years, around 10 to 14% people are affected with diabetes, and if you look at Hyderabad data, it's around 17%, which is very much high. 50% of these diabetic patients doesn't know that they have diabetes, which is very important. So now let's begin the risk factors for diabetes. The number one risk factor, the first risk factor is genetics or family history. Means if you have a relative or a close family member who has diabetes, the chances of you having diabetes is increased. How much? It is found that if a single parent is affected, then chances is increased by 3 times, and if both parents are affected, the chances are increased by 6 times. The next risk factor is ethnicity or race. We Asian Indians are at increased risk of diabetes mainly because of our diet habits, because of our environment, and because of our genetic makeup. The next risk factor is age. As we age, the chances of diabetes also increases, especially above 30 years. As we grow old, the chances of diabetes increases. So all these 3 risk factors are non-modifiable risk factors, means even if we want to change them, we cannot do. So coming to the next risk factor, which is modifiable risk factor, that is obesity. We all know that obesity is increasing throughout the world, and in India also it is progressively increasing very fast. Obesity is a major risk factor for many metabolic diseases including diabetes, hypertension, cardiac diseases, obstructive sleep apnea and others. As the severity of obesity increases, the chances of diabetes also increases. So how do you know that you are obese or not? For that, simply you can check your BMI. For that, you need your height and weight, and you can put that values in apps or online, and you can check your BMI, and if it is come above 25, then you comes in a category of obese and the chances of diabetes increases. One important thing here is, in Indian population, the deposition of fat is mainly around belly region. So because of that, we need to check waist is to hip ratio. So in waist is to hip ratio, how we calculate is, we need to check circumference around the waist, the maximum girth around our belly, to the ratio of hip, the maximum girth around hip. The ratio should be less than 0.89 in males and less than 0.81 in females. If it is more than that, that increases the chances of diabetes. So it is also found that the person sometimes having normal BMI, but because of the increased waist to hip ratio, the chances of diabetes is increased. Coming to the next risk factor, which is obesity in children, that is childhood obesity. Childhood obesity is also increasing very drastically in India, and if your child is having obesity and if he or she doesn't attain the normal BMI by puberty, they have found that the risk of getting diabetes in adulthood is increased. Coming to next risk factor, which is decreased physical activity. We all know because of lockdown, because of online shopping, online classes, online food and work from home, the physical activity is decreased very much. So because of that, the risk of many diseases increased, including diabetes, cardiac disease and hypertension. And it is interesting to know that they have found the decreased physical activity without gain in weight is also linked with increased risk of diabetes, which is very commonly seen in young IT professionals who have very decreased level of activity. Coming to next risk factor, that is diet. We all know eating unhealthy diet containing high carbohydrates, high sugar containing food, refined carbohydrates, high sugar containing beverages are bad for health and we should not eat, and those things increases the risk of many diseases including diabetes. The next risk factor is sleep. The decreased quality and decreased quantity of sleep is also linked with increased risk of diabetes. So we should improve our sleep habits. We should not sleep late in night. We should have a good sleep duration around 7 to 8 hours daily, and we should not use mobile phones late in night, which affects the sleep quality. The next risk factor is pre-diabetes. If by chance you have checked your blood sugar levels for routine checkup or any other purpose, and you find out that your blood sugar levels are between 100 to 125 milligram per deciliter in fasting, or postprandial between 140 to 200, or HbA1c between 5.7 to 6.4, you comes in a category of pre-diabetes. If you don't take steps now, there is 80% chances that you will get diabetes in near future. Then other risk factors are certain medications and toxins which can increase the risk of diabetes. Certain medications like HIV drugs, certain psychiatric medications, and long-term use of steroids or hormonal therapy can increase your blood sugar levels and can increase the chances of diabetes also. The link between smoking and diabetes is, no direct link is found. And one more thing is low levels of vitamin D is also found to have a risk for diabetes, but the strong evidence are lacking. Taking alcohol more than 3 drinks per day also increases the chances of diabetes. Coming to next risk factors, certain conditions are there which can increase your chances of diabetes, like in females PCOS, that is polycystic ovarian syndrome, or which is very common in females, and giving birth to a baby of more than 4 kgs, or having diabetes in pregnancy, that is gestational diabetes. All these increases the risk of diabetes in female in near future. And certain conditions or certain cancers like endocrinal cancers and chronic pancreatitis also increases the risk of diabetes. So that's it, friend. If you have any of these risk factors, please do check your blood sugar levels every 6 months, and if it comes in pre-diabetic or diabetic range, please do visit your doctor.